The FDA, the Food and Drug Administration, considering a major shift when it comes to the COVID vaccine, including a new proposal to make it an annual shot for most adults and children, similar to the flu vaccine. That idea is set to be discussed at an advisory panel meeting on Thursday. NBC medical contributor Dr. Natalie Azar is here to explain what it means for all of us. Dr. Azar, always good to have you. So, I mean, this flu shot model proposal, essentially, what do you make of it on its face?
So I think that all experts would agree that the process needs to be simpler. Okay. I think where we're going to see the debate is whether or not there really is a wisdom to updating the vaccine every single year for variants that are changing so rapidly. And I think we're also going to hear a lot of discussion about who should be eligible or who should be getting this updated vaccine every year. If you're young and otherwise healthy, is this something that you should be doing? And it raises the philosophical question of, you know, what's our endpoint? The vaccines are still working very well to prevent hospitalization and death, but folks out there who are living with long COVID, many patients who I see would argue that preventing infection is really important. So is it cost effective to be doing this? What about concentrating on that nasal vaccine? What about a universal vaccine? So I think it's going to be a very lively debate, and I'm very, very much looking forward to tuning into it.
Well, it's scarce resources, and it's how do you spend them on a yearly shot or some other research.
Precisely.
That's the question. But there's also talk about, you know, we're supposed to have started with the two vaccines, and then you get your booster. There's talk about having you, if you've never had a vaccine, just coming in and getting the booster and that's it. I mean, do we even know if that would work?
So that is the #1 red flag for me, is that we don't. And, you know, we've had to do a few things without all the data that we've wanted, like authorizing the bivalent vaccine. But, you know, the rationale there, I think, is pretty straightforward. It's like if you have someone who's thinking, oh, God, now I'd have to go get the 2 shots and get the booster, does it streamline it? On the other hand, again, like I said, there's no data for that. And so I think we're going to hear a little bit of pushback. You know, there's going to be some never-vaxxers who are going to say, I don't care if it's 1 shot or 3 shots, I'm not going to do it. We'll see.
We've done a lot of stories on the triple-demic, the flu, RSV, and COVID, and now we're seeing that the numbers are going down. So does that mean that the worst is over? We're through that?
That we're out of the woods?
Out of the woods.
Okay, well, what have we learned so far? We do not make predictions, especially live on air, about what is going to happen. With RSV, we sometimes see another spring surge. With flu, we sometimes see a lull, and then we get the strain, the B strain. We've seen the A strain so far. Get your flu shot because it covers 4 different strains, including A and B. And with COVID, we never make predictions. So listen, we're doing really, really well right now. You know, 5% of hospital beds are being taken up by COVID as opposed to 21% last year at this time. So things look good, but it's just the start of winter. So time will tell.
Thank you, Dr. Natalie.
Thank you.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.